We want to look up, Debbie. So instead of looking at our laptops, we'll look up at the screen.
Yeah, okay, that sounds good. We can do
have
that.
Have you more eye-to-eye contact with David. All right.
I can do that.
So we've got Fraser with us. Nice to see you, Fraser. Welcome. Ursula's here. Helen, Gary, Cindy, Andrew, Adrian, Vanya, Emma, of course, David. I'm not sure if John's going to be able to stay. He's watching his kids, so he's going to probably be a bit in and out. And of course, Debbie.
I'll be staying. Don't worry. Just.
Are you? Oh, well done, you.
Yeah, I'll stay. I'm interested. So, yeah. But
okay.
I'll be on mute, and the video will stay off because my daughter's very interested.
Oh. Right, I think we're just about ready to start. So I'll just get my share screen up, and then I'll do a little formal intro so you all know when to behave yourselves, okay? Okay.
Yep.
Recording in progress.
Thank you very much for joining us today for the first in 3 of our Technology and Humanity in Healthcare webinar series. We're delighted that David Wortley, who's one of our visiting academics here at the university, is going to be taking a lead on those and sharing his expertise over the next three events. So I'm Debbie Holly. I'm the Professor of Learning Innovation here in the Faculty of Health and Social Sciences. I've just finished some work with the EU looking at their digital competency framework for health and safety and well-being. And some of those kinds of experiences obviously illuminate some of the work that we'll be talking about over the next 3 sessions. And my research interests are in innovation and simulation, and especially thinking about how we can enhance the student experience with digital technologies. So joining me today is Dr. Anthony Basil, I should say. He's our researcher who's working with us on our Health Education English projects, and he's had a lead on innovation and innovation technology as part of his role with us. In his previous life, he's led numerous institutional-wide TEL innovations and implementations, so we're very fortunate to have him working with us. So, without further ado, I shall welcome David, and then we'll just go through some housekeeping slides, and then we'll be off. David was the founding director of the Serious Games Institute at Coventry University. He succeeded in establishing this centre as an international centre of excellence for serious games and immersive technology research, and really significantly linked to regional development. So he designed the research infrastructure, the development strategy, and they had business incubation, academic research and innovation showcasing in the same building. And that model has now been copied in West Virginia, Singapore and South Africa. He's committed to educational innovation, as can be evidenced by his extensive leadership and presence in Second Life, among other locations. And he's an expert advisor, reviewer, raconteur, and a business mentor for the EU Horizon 2020 technology calls. He's much in demand as a keynote speaker, and we're thrilled that we've managed to get him for three webinars with us. So, highly delighted to welcome David. So if you'll just give me 1 second, a warm welcome. Just a little talk about how David will be sharing his views on disruptive technologies and how they're likely to affect the nursing profession. He'll be sharing examples from his collection, and after which we'll invite audience questions. So as we're going, please pop all your questions into chat, and then we'll have a whole lot of questions in chat, and then we can do that. So I think David's aiming to speak for about 35 minutes, and so there'll be plenty of time for discussion. Housekeeping, we're recording. If you don't want recorded, if you amend your name on the screen and keep the video off, questions into chat. And if anybody is a Twitter person, our Nurses Research Centre is at Nurses for Long-Term Health. We'd really welcome any tweets. So enjoy, and then there's a little link there to the next event, which is on the 15th of June, where we'll be talking about the metaverse health and well-being. And there's our links, just in case you want to take a quick photograph to get in touch afterwards. So I think that is just about it. I'm going to stop sharing my screen and come back to the Zoom meeting here. And I just need to accept that, and I come down here now, and
Brilliant.
I am just going to swap cameras over so it's a little bit more like I'm going to be interviewing David. So David, thank you so much for coming and joining us today. So what are we going to be doing?
Well, Debbie, thank you very much for your. I'm blushing already with your very kind words. If I just to spare myself embarrassment and to get straight on with the presentation, I'm going to stop my video and I'm going to go into my presentation. And one of the innovations that we, in a way, we're testing out today is the use of a virtual reality environment, virtual television studio that I'm going to be doing my presentation from. So as soon as I start sharing my screen, you'll see me in this virtual television studio, and I'll go straight into my presentation. So I'm going to stop my video now. Okay, you should now be able to see me in.
We can. It looks fabulous.
Yeah,
I'm going to mute myself as well now.
Okay. Well, I should say right at the very beginning that this is not a real photograph of me. It's an avatar generated by artificial intelligence. And in the studio, I'm just going to give you just a few views of the TV studio that I will be likely to toggle through doing my presentation. Yes, so this isn't real me. It is me, but it's an AI generated avatar. And I'd like to show you just a few more of these as my introduction. So I'm going to begin by talking about some cool things you can do with AI and VR that are relevant to nursing education. And I want to make the point that, you know, this is all very hot topic and it seems very new, but actually it's the ideas behind all of this have been around for a long time, going back to my early days at the Serious Games Institute, so 15 years ago. I'm going to give some good news, and then I'm going to reveal some avatar pictures of Debbie and Anthony. And then I'm going to start by asking what ChatGPT thinks about the future of AI. I thought if I'm going to talk about ChatGPT, at least I should give it an opportunity to give its views on the future of nursing education. I'm going to show you some examples of AI and VI in nursing. I'm going to talk about the COVID effect because this is relevant to the acceleration in the use of digital technologies in all aspects of our lives. And to go on to a couple of other relevant things which are related to what's likely to happen with the future of nursing, and one of them is the Ageing Society Challenge, and the second is the focus on preventative healthcare and digital therapeutics. My summary and conclusions won't take very long, and then we'll be able to open up into to questions. So here are some of my other alter egos. All of these avatars were generated. I've actually got 100 of them, but I've picked a number of them so you can see that there are likenesses from these AI generated avatars. In fact, I'm quite tempted to not show my real video on some of these presentations that I do and use my avatar instead. I want now just give you another quick example of how within my business I combine artificial intelligence and virtual reality to show some examples of the kind of work that I do. So what you see on the right of the screen there is actually an artificial human. This is an artificial human And what I've done is I've programmed him with some audio that I recorded to talk about the kind of work that we do at 360 and 360 immersive experiences. So you'll see a number of examples of 360-degree virtual environments that reflect the kind of things that we do in the business. So I'm going to start playing the video now.
How would you like to fly over the city of Kuala Lumpur at night?
So this is actually a real photograph of Kuala
You
Lumpur
might
at
enjoy
night with a
visiting
drone.
museums in Milton
This
Keynes.
again is a 360-degree
Would you
photograph
like
of
to
a
be able to
museum,
relive
a
very
recording of
special
a family
occasions and
event
family events?
with my
Imagine
partner's
what
father,
it's
who's
like
now
on the
passed
footplate
away.
of the most famous steam
I love steam
locomotives.
locomotives, and I've got quite a few
360 in
immersive
360
experiences on the
immersive
footplate
experiences,
of
specialising
steam
in capturing
locomotives.
these moments in time.
I use
Use the latest
360-degree
technologies to
photographs
capture
also to
panoramic
capture
photos
living
and
memories.
videos in high quality.
Another drone video of my
We hope you'll
hometown,
share these
Boston
special
in Lincolnshire,
experiences
with the
on
Boston
web,
stump.
smartphones and virtual.
They can be shared on
We are
all
Google
kinds of
Street View Custom
environment.
Pro. Take a look at some of the examples on this page.
So this is what I have on my opening page. So I'm now going to go on to the next, and this is going back in time, right at the beginning of when I started as the founding director of the Serious Games Institute, and I think you'll be quite impressed by what was developed by a local games company. This is a games company called Blitz Games. They set up a Serious Games arm, and they wanted to show how you could use games technologies and 3D scanning to create avatars, lifelike avatars, that can simulate medical conditions and also be used in training of people like paramedics. So I'm going to play the video now. So this begins with a 3D scan, and they use a 3D scan to create some algorithms that actually manipulate the facial expressions of this avatar. So by using a variety of slider bars, they can create all kinds of emotions, and so you can imagine how these can be used within video games, but they can also be used in all kinds of different simulations. And what I'm going to go on to now is to a simulation that links medical data to show nurses and medical practitioners what the experience of watching someone die from a head wound. So on the left-hand side you see the avatar in his normal condition, and on the right-hand side you see someone who is going to die in the next 30 seconds. And what you'll see is how the medical data is being used to simulate the blood flow. It's going to simulate the pulsing of the veins in the neck as the body tries to cope with a situation. You'll see the avatar changing colour and become pale. You'll see the avatar sweating. You can see the veins pulsing now. And within 30 seconds, you'll see what it's like to watch somebody die from a head wound. He's now reaching the end. And all of this goes back to around 2007 and 2008. So that's one example of a video, but I also want to show you an example of other practical uses of this same technology. And in the top left-hand corner of the screen, you can see a scene from a product called Triage Trainer. And the idea is that people are unlikely, hopefully, ever to have experienced triaging people who are victims of an explosion in a city centre. So the city centre you see there is based on Leamington Spa, and you'll see the explosions, and they use this to set up a series of avatars who need to be triaged. So this was actually a game as part of a research project to establish whether you could use virtual reality and simulations like these to replace some of the traditional methods of nursing training or paramedic training using typically mannequins. So the idea is that the players in this game go around the city centre triaging 4 or 5 patients, and they're measured on the accuracy of their triaging and the time it takes to do that. And the results of this research project indicated that these types of simulations are more effective than traditional methods, and the reason is that people find them more realistic, and so they're more engaged in them. This is an example of virtual hospital ward, going back to those early days, a little bit primitive. And then at the bottom of the screen, this is another project called Patient Rescue, and you'll see 3 avatars at the bottom. The idea is that you could automatically generate an avatar with different ages, ethnicities, backgrounds, and medical conditions. And you could use these avatars to simulate medical conditions to train new doctors coming into the profession, because when they first start, they won't have dealt with lots of conditions, and you're able to show them things that they may not, it may even not ever come across in their lifetime. But so this is not new. This is the point that I'm trying to make. It is not new. But the good news is that AI and VR are likely to benefit the nursing profession substantially. And I've taken the liberty of repurposing pictures of Dr. Holly and Dr. Basil. Dr. Holly has got a nurse's uniform on and a seaside background. And Dr. Basil, I wanted him to be in a white doctor's outfit, but that was beyond AI. So he has got a hospital background. And the picture on the right is not an actual photograph. It was generated by artificial intelligence. So there's some good news, and I want to explain why AI and VR are likely to benefit the nursing profession substantially. And one of the reasons is, and it's something that really inspired me from an online conference that I did some time ago, and it was a lady presented a project called No One Dies Alone, and essentially it showed the value of the nursing profession and the human values of nursing that are very unlikely to be replaced by AI. Nursing is a vocation which is based on human values like empathy and intuition, and all of these things are unlikely to be replaced by AI, at least not in the near term. So what does ChatGPT say on AI and nursing education? And I asked ChatGPT to give me 10 quotes and academic paper references on the impact of AI in nursing education. So the first one says it's got the potential to revolutionise nursing education by providing personalised learning experience and real-time feedback. I agree with that entirely. AI-powered virtual tutors, 24/7 support to nursing students, allow them to study and practice at their own pace. And the use of AI in nursing education can increase students' engagement and motivation, leading to improved learning outcomes. So I agree with all of those. What does it have to say on nursing roles? Again, I asked ChatGPT the question. It's got the potential to augment the clinical decision making and diagnostic skills of nurses, leading to improving patient outcomes. It can help reduce the workload and burnout of nurses, allowing them to focus on high-level tasks. And it can provide real-time access to patient data, allowing them to make more informed decisions and provide better care. Again, I don't have any issues with any of those. What about nursing education with VR? VR can provide nursing students with immersive hands-on learning experiences that simulate real-world patient scenarios. And these may be scenarios they're unlikely to hopefully encounter in real life. It can also help students develop clinical reasoning and critical thinking skills in a safe and controlled environment, and it can provide students with interactive and engaging learning experience that are less stressful and more enjoyable than traditional methods. So I happen to agree with ChatGPT on those. I didn't actually check the validity of the academic references, but I can leave somebody else to do that if they watch a recording of this presentation. So AI and VR in nursing, and I already mentioned that AI has the potential, maybe that not everybody knows about, to be able to create artificial images and videos. So in this case, I used an application and I told it that what I wanted a nurse using a smartphone in a hospital environment, and I wanted it to make me a picture of a nurse using VR and some haptic technologies in training. So, what about the impact of AI and VR nursing responsibilities? Well, I think this is one of the really big changes that we can expect over the coming years, is that it's likely to have a major impact on changing nurses' responsibilities and practices, because with the assistance of AI and VR, nurses will be able to take on tasks that have been traditionally done by specialists. And an example of this is a radiologist. Now, a radiologist traditionally has one of the major tasks is to be able to not only scan patients with their X-rays or MRI scan, but also to interpret the data and recognise whether some medical intervention is involved. Well, we've already reached the point where AI has got the ability to actually provide more accurate diagnoses than human beings. So in that instance, and in many others in medical practices, particularly where AI and big data is being used for medical diagnostics, it creates opportunities for nurses to take on high-level skills. It also empowers nurses, and I don't have a thing about doctors, but if you look at the doctor's medical bag, it hasn't changed in not only in decades, in centuries. So doctors and their medical bag still have stethoscopes and a range of blood pressure devices which are, age old, and we're reaching the point now, particularly with some of the wearable technologies and devices that are being consumerized, that nurses will be able to support many of these things by using the data that is collected from these types of devices. And I think there's going to be a shift in the way in which we handle the long-term care of patients particularly. I want to show you another example, and this shows a transition from in a surgical environment from maybe a traditional surgical ward to the latest robotic surgery. But in between, the example I've shown is actually my partner. My partner, Jackie, she actually has no medical training. She has very little interest in computers and absolutely no interest in simulation and games. But she came with me on a trip to Kuala Lumpur on one occasion, which was to do with a medical technology conference. And pardon me, one of the booths there was actually a tool to train surgeons on laparoscopic surgery. So what Jackie is looking at on the screen is laparoscopic surgical tools, and this is the task is to remove a gallstone using the laparoscopic tools with haptic feedback. And she was able to remove a gallstone and get better results than many trainee surgeons through the use of these kinds of technologies. So technology is very empowering, but it's also very challenging to establish practices. Virtual reality, I know Bournemouth University are doing some fabulous things with virtual reality and devices like the HoloLens and augmented reality headsets, and this is just an example of how a nurse can be trained with something like a HoloLens that will enable her to find her way around the human body and learn about it in her own time and her own pace. So But it's not just a case of artificial intelligence and virtual reality. All of these things are made possible, and this is why it's taken so long for AI and virtual reality to become more mainstream, is that